So this video is going to take a quick look at the medical history sub-tab of the chart tab on the CNC patient chart. So here we're already in the diagnosis area, and we're going to move one tab to the right here and go to the medical history area. Medical history is different than medication list and diagnoses and all the other tables we've looked at so far, because in this table each patient only has one entry. So the patient only has one medical history, and that's going to track kind of their long-term medical history. And so if we want to view it or make changes, we can click View or Change. So let's view the medical history for sample patient Ethan Lazarus. And here's the fields in this table. You've got the patient's name, their date of birth, their age, their gender, their primary care doctor, their specialists that may be involved, family history for this patient, family medical history, hospitalizations and surgeries, smoking history, alcohol history, drug history, over-the-counter medications, and medication allergies, and number of children. So that's the patient's medical history fields that are tracked. And if we want to edit their medical history, we'll click the edit icon. And once we're in their medical history, we can adjust various things, like which specialist this person might be seeing, family history, and anything else that we needed to change. And again, this is just to track their long-term medical history. Let's say they're now allergic to penicillin. We could edit that. And so when we edit that, and we'll pop back back over, we'll see that on the chart header now you can see that the patient's allergic to penicillin. Before we close out this video, I should talk a little bit about how that medical history table is created. So when a patient first submits their health history, you may remember that that gets entered, and we can access that here from Communications, Patient History, Demographics. This was the patient submitted history, and we can go in and take a look at that. And the patient has provided all of the fields that are necessary in the medical history. They've told us who their primary care doctor is. They've told us who their specialists are. They provided the family history and their medication allergies at the time that they filled out this history. When the medical provider goes in and reviews this history, we can make any corrections or fix typos or proper medical terms. We can make any changes in here that we want. The primary care doctor. And when we're done reviewing that medical history, we sign off on it. So we say reviewed by Dr. Lazarus, and we put in our digital signature. When the CNC patient chart sees that this note has been signed off on, just one time only, it takes all of the relevant fields from the patient submitted medical history and automatically creates this medical history table for us. So now they're no longer linked at that point, but it'll save us doing double entry and having to re-enter all these items. Hope that clarifies how this table got created.